Dr. Brill, can you provide us with a brief overview of the supply chain?
Different facilities will have different processes, but in a nutshell, there's some sort of committee that evaluates that new device or new supply, brings it to the executives and sometimes the physicians, and they make a decision whether we should add it or not to our facility. And the problem with the supply chain is that in an area of increasing consolidation, there may be less opportunity for new devices and emerging technologies to get a foothold within a facility setting.
So at this meeting, so many new innovations were discussed. How can physicians bring some of these to their practices?
Well, I think there's a real need in this day and age to bring new technologies that are going to help us as physicians to improve the care for the patients that we serve. So there's a two-part process here. One, of course, is for those device manufacturers to work with physicians, help them to understand what are the benefits. How do those technologies improve outcomes? How does it help us to provide the service for the patient in the least costliest setting, things of that nature? And then they have to go collaboratively and collectively work with the facility, work with the ASC, work with the hospital to see how we can try to bring those technologies and make them available to patients.
So cost is obviously an important factor. How can physicians manage this concern while still keeping pace with new innovations?
Cost is a very serious concern. And it's not just the cost of technology, it's also the fact that our insurance process is moving more and more patients into high deductible plans where patients are bearing not just hundreds, but oftentimes now thousands of dollars of the cost for their care and these new technologies. So I think we've got to look at some innovative models. Some of those might involve helping patients to finance those new technologies. There may be other things like looking at collaboration or risk share, guarantees, things such as if this new technology achieves a certain outcome or the like, that's fine. If it doesn't, maybe that there's some rebate or some amount that goes back to the patient or the purchaser, such as their employer, if it doesn't achieve the desired outcomes.
How can the AGA Center for Innovation and Technology help members through these purchases?
Well, I think one of the things that the center has been doing for over the last half decade is serving as a neutral, honest broker and a forum for honest conversation with device manufacturers, innovators, inventors, venture capitalists, private equity, physicians, regulators, and payers. We're all in this together. We've come from a background where for years it was siloed. I'm here to sell you something. And now in this day and age, it's a team sport. We all have to collaborate and we all have to work together in order to make these technologies available so that we can achieve the goals of better care, better health, better outcomes for patients. And the center can serve as really as that neutral broker, that middle force that brings everybody together and can help people to achieve and understand what those outcomes can be, what is value and what can be valuable, and how can we help frame the discussion so that people get these life-saving, necessary technology services, diagnostics, pharmaceuticals, and the like, so we can improve their care.